Good morning, my name is Joanne and this is my reflection video for D028, Phase 1, Review of Evidence-Based Practices for Effective Transition of Patient Care. This task actually helped me understand about readmission prevention, and I am surprised to learn that there is actually a rule established by CMS HRRP. I came to realize that hospital readmission prevention is not only for the sake of the patients and their families, but also for the facility reimbursement. That unplanned readmission brings about severe consequences, not only for the patients and their families, but also on the institution and the health care system. I have learned as well that CMS made hospital readmission a quality measure to evaluate quality of care rendered by the hospitals. Therefore, if a patient has been readmitted to the hospital related to a previous condition or a diagnosis, the hospital will not be reimbursed of the expenses. So that's a huge loss. In addition, penalties and incentives for hospitals are included in the policy changes by CMS. That is why several approaches have been made to improve discharge educations and plans for patients when transitioning to the community or homes or any facility they're going to after discharge to decrease 30-day readmissions. The case coordinators play an important role in determining the best option for discharging patients. The doctors, the nurses, and the pharmacists as well play key roles in the success of discharging a patient. But on top of that, it is also important to ensure that the patient and their family members understand their roles to ensure that the goal is met even when they are outside the hospital. So the case that I chose is the hip replacement, total hip replacement, and my patient is Susan. She is a 68-year-old female who had THA 4 days ago and is being discharged, and she is being discharged with Lovenox and some prescription pain medications. So therefore it is important for her to learn to self-administer the Lovenox shot, which is a blood thinner shot to prevent blood clots, and it's important for her to understand what it is for and the route of administration and how often. And also to emphasize that this medication should not be stopped unless her doctor says so. So she has started therapy a few days after her surgery, or a couple of days after her surgery. So therefore, she should understand to continue her exercise at home, but to reinforce education about limitations about not crossing her legs or not bearing weight on that affected leg, and so on and so forth. Also, she is a part of her comorbidities is obesity. So in order to prevent complications, education must be done regarding her diet modification, because it says in her part of her history is that her and her husband eat a lot of canned goods and processed foods a lot. So it is important for them to understand to modify their diet. Also, it didn't say in her history if her house is a 2-level house or 1-level house. So if that is the case, if she lives in a 2-level house and her room is upstairs, then it's important for her to probably move to the first level room, that way to minimize going up and down the stairs. Also, a disability or disabled decal or an ID is encouraged, just in case if she will need a wheelchair or a walker later on in public. That way they will have easy access to areas to maneuver their equipment. Most importantly, she should follow up appointments or keep her schedules with the follow-up appointments, and ensure that transportation is available to take her to and from the appointments, especially with her twice a week outpatient sessions. So yes, that's the education I will give Susan before she discharges. That way, of course, I will have to encourage her to ask her questions, and give her a phone number for her to call, and point out possible complications and what to observe. And if she sees these things, to call her doctor immediately or go to the ER. But hopefully, if she follows these instructions, wound care, weight-bearing instructions, exercises, diet, medications, so hopefully these will decrease the chances of her being readmitted. Thank you for listening. Bye.